Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jarek Taylor. Joining me today is the founder and CEO at Ayble Health, Sam Jactel. Sam, how are you today?
Hey, good, Jared. Thanks for having me.
Excited to have you on the podcast. You and I ran into each other at HLTH. It was a great conference, a lot of walking, but a good time, a lot of good content.
Yeah, absolutely. Ludacris wasn't bad either. So,
There you go. Yeah, whenever Ludacris, you know, comes out of wherever he's at and puts on a concert, it's usually not a bad thing.
exactly.
Since it's your first time on the podcast, Sam, I'd love if you could tell the audience a little bit about your background and then tie that into an overview of Able Health.
Yeah, happy to. So, I started my career in clinical research, focused in the pediatric space. Spent several years as a strategy consultant, kind of launching new drugs for pharma companies, doing kind of top line revenue growth strategies for health businesses, insurers and others. Spent a little bit of time in health tech investing, got my MBA, and so kind of putting this all together to solve a problem that I've been living with for about 10 years. So back in 2014, I was diagnosed with inflammatory bowel disease, which is kind of a chronic inflammatory condition in the gut. I'll spare you kind of the details. I'm sure you can put two and two together. It's not a super comfortable existence, and for me, it's been a pretty tough process over the past 8 to 10 years to manage this condition. And one of the things that I realized was that I was really not getting any support outside of the clinic. And so I'd go in and, I was seeing the best physicians I could get access to, and I was able to afford the care, which is not always the case. And I was still not getting my symptoms under control. It's a really frustrating experience. And I think that just generally means that patients like me are generally sick, and that means we're also very expensive. And so, when you're thinking about this general population, it's about 25% of a commercially insured population has a GI diagnosis. And an additional about 10 to 15% have undiagnosed or underdiagnosed conditions. So they have these symptoms. And we're talking about $140 billion of direct medical spend each year, which is more than mental health and trauma. And so it's kind of a wild situation to think about that, people like me are more expensive than people who get in car accidents and have heart attacks every year. And I think the reason why it's so tough to manage these conditions is that the current tools available to us are really only treating part of the problem. And even with the best drugs that we have available, using them alone is getting people into remission about 40% of the time. And for most other conditions like IBS, for example, which is maybe a little bit lower acuity but much higher prevalence, drugs aren't really first line care. And the things outside of the clinic, so dietary intervention and mental health support, psychological interventions, are shown to drive outcomes. But the second you walk out of the clinic, you have no support. And the best that I ever got was like a pamphlet and instructions to figure it out on my own. And so Ayble is the tool I wished had existed when I was diagnosed. And so we are aiming to become a comprehensive ecosystem of care beyond the pill. And our first flagship product is addressing this diet piece. And so what we've built out is a proprietary program that takes about 12 to 16 weeks that helps identify and remove trigger foods for every individual that has these conditions. And then we hold their hand with a health coach and a nutritionist and dietitian, and we provide them last mile nutrition tools so that they can find products that are compatible with their diet, browse through recipes. And really the goal is to empower those patients to eat the way that they should, in a way that's not restrictive, in a way that gives them that freedom, but also drives those outcomes in a way that they wouldn't be able to get that kind of support in the clinic.
And you mentioned it a little bit in kind of your personal why and tie that into Able Health, but can we dive more into the limitations and gaps that the current standard GI healthcare has?
Yeah, I mean, there's a lot, of course, but I think if you want to just put like your MBA hat on, your just standard math, the supply doesn't meet the demand. And so if you kind of look at all the different specialties, GI is one of the worst in terms of there's about a 2,000 GI shortage in the country by 2024. That's a gigantic gap, right? And the interesting thing is that those GIs also geographically are not located, superimposed with where diagnoses are, right? IBS doesn't care if you live in a state where there aren't enough GIs, right? If you look then at the subspecialties, right? So the GI focused dietetics and the GI focused psychologist, it's even worse. Um, GIs also don't get a ton of training in medical school on elements like, GI focused psychology, GI focused, diet and nutrition. And so I think the reality is just like the ecosystem just isn't built to scale to be able to provide these interventions, even though the guidelines are clear that it provides those outcomes. And so what we're using is technology to be able to scale those interventions, personalize those interventions. And one of the things that we're really excited about is that we've built out the largest GI database in the world for this kind of data. And we've put machine learning on top of it such that every patient that contributes to the platform in an anonymized, aggregated, de-identified way contributes to a better, faster, more effective experience for the next patient. And so in doing so, what we're not doing is taking standard of care in brick and mortar and just putting it virtual, because that doesn't solve the outcomes problem. What we're really doing is iterating the standard of care on a more regular basis.
And Sam, you're in a unique position, right? Because before we started recording, you and I were kind of diving more into your background and how you have a strong personal why for why you wanted to start Ayble Health, and we kind of went back and forth and how usually those are the best companies, right? When you have that personal why, you have that North Star that you want to focus in on, and then you find out that there's lots of other people that have the same problem, and now you're really passionate to go out and solve it. Can you talk us through, like, in addition to that, like some of the unique benefits that patient founded companies have?
Yeah, and I think there should be more. So I think like a big kind of thesis that I have is that patients often are the CEOs of their own condition, right? In an ecosystem which we know is siloed and broken, and where often like no one is advocating for you in that clinic. Um, it's the onus is on us, on me, to collate all of it, whether it's the data that is siloed in different places, whether it's the one physician is saying one thing and another physician is saying something completely different, whether it's not finding any of the answers and then going on Google or reading articles if that's kind of the inclination. Patients end up being that core center quarterback of their own care, even maybe if that's not the optimal way of doing so. And so patients are resourceful as crap, right? Patients know where to go. Patients are also I think we assume that we know where a patient is a lot of times, right? Even a physician sees tons of patient, but unless you have experienced the thing at the end of the day, I think it's tough to solve for a problem you don't know directly. And so patients know that very concretely, and so can solve for those problems in a way that maybe others can't because they haven't had that experience. But I think there's also like an interesting caveat here, which is that people are N of one, right? So one of the things that we have to be careful as patients is to not do me search and do research, right? And so I'm a white male from a privileged background, and I think it's important to understand that like I'm not the customer, right? It's people like me that share similar experiences, right? Of course, but understanding how that applies to others. And so I'm a big proponent of patients as founders, but I also am a big proponent of leading with evidence and leading with data. And so we've been around for 3 years. 2.5 of that has been in the clinic, and we have 3 peer-reviewed publications in 3 leading GI journals that show that our outcomes are better than brick and mortar, better than virtual clinics. And oh, by the way, the NPS score is really high because we meet the patient where he or she is. And so I think that both of those bars need to be at that same level. And so I'm a big proponent of that, and excited to see more patient founders.
What's next for you and Ayble Health, Sam? I know a lot's been happening, but what are you really excited about as we head into 2023 and beyond?
Yeah, no, we're really excited to get this in the hands of people who need it the most, right? And so we've taken some really strong research that we run on our own program, plus 20 years of research that exists already in the literature. And I want to give it to people so that they can feel better, right? Our goal is very simple, right? Get someone to feeling better faster, increase the likelihood that they do feel better, and then keep them better longer. Now, of course, that triple aim is it's a big goal, but yeah, that's really exciting for us. We have some great investors, but getting that commercialization piece in Q1 is going to be really exciting for us. And then we talk a lot about diet, but if we want to be comprehensive, we also need to include addressing the mind and the gut. And so we've been doing a lot of really exciting research and should be launching in 2023 something that is essentially a personalized psychology program that is gut directed, and we're really excited about that.
Well, Sam, I want to thank you once again for coming on the Slice of Healthcare podcast. Can't wait to have you come on again soon. We'll dive into some other topics, but it was great to learn more about your background and Ayble Health, and also get your take on two really interesting subjects, right? Unique benefits of patient founded companies, and then also the limitations that the current GI space has.
Absolutely. Thank you so much for having me, and excited to come back on.